Heartburn or reflux disease is probably one of the more common diagnoses in our society. It's an easy diagnosis, certainly based on symptoms, and classically what is given out in conventional healthcare is acid-suppressing medications. People can get these over the counter now, Prilosec. Weaker alternatives, weaker versions of this would be Zantac and Pepcid, but most of these folks are on prescriptions, and most of the evidence, if not all the evidence, really favors using these in very short bursts of time, 2 weeks, 4 weeks, typically no more than 6 weeks. Unfortunately, most people take them for months and even years, and we just keep refilling them and refilling them. One of the reasons for this is that when people stop these medications, we now have evidence to show that there's almost a withdrawal effect, and people get immediate reflux upon stopping these medications, sometimes more severe than the original symptoms. So obviously, folks are then motivated to stay on these medications. The downside and the long-term side effects of these is huge. Increased risk of fracture, increased risk of B vitamin deficiency, now a significant increased risk of colon infection, C. diff colitis, which can sometimes be so severe people have their colons taken out. So these are not medicines we want to be on long term, but as I said, they're very difficult to get off of. Our approach typically involves multiple different things, both diet related as well as supplemental, in the short term to help support the digestive system and allow people to slowly wean off of these medications. So we'll often advocate the elimination of gluten and dairy from the diet, maybe not long term, definitely during the period of trying to transition off. These foods are traditionally difficult to digest and may be culprits in the original symptoms of reflux. And then we often will use a supplement called Iberogast. That's a combination of herbs to show good evidence in its original treatment of reflux. And to me, this is where people should start if they aren't taking anything for reflux. But getting started with this before every meal and taking it for 5 to 10 days before starting to wean the medication seems to be very effective. Taking it for 2 or 3 months afterward, and then again gradually trying to wean that. Iberogast moves things through the digestive system, and so it promotes good digestive function as opposed to taking away something very necessary for digestion, and that's acid. We'll often also use probiotics. Sometimes people with nighttime symptoms would consider melatonin. Melatonin seems to close the muscle between the esophagus and the stomach, not allowing acid to track up at bedtime, particularly when we're lying flat. And probiotics also can be very effective as well. So hopefully, if you're not taking these acid-suppressing medications, some of these tools or some of these ideas can help you prevent needing them and actually improve the digestive process. If you're on these medications, it's really time to reconsider and get started on other alternatives, because these side effects are gigantic. I didn't mention iron deficiency as well as magnesium deficiency as a byproduct of shutting off acid in the stomach.